How can women better recognize and respond to the risks of vascular disease? So over 230 million people in this country have peripheral arterial disease, and 50% of them or more are women. However, they are not well recognized and they are not well studied. Two recent publications that we've been waiting for decades to come out have representation of women 18-25%. We should be doing a better job of early detection and recognition of peripheral arterial disease in women. We hear about women having atypical chest pain for cardiovascular disease, and there's been a push for women's cardiovascular health. Those symptoms are better recognized, but are we doing the same job in peripheral arterial disease? And unfortunately, currently the answer is no. In the same way that women present with different symptoms for cardiac disease, they're often presenting differently in lower extremity disease. Pain and cramping that we see in men may be a dull ache or small wounds, and they are not often recognized or detected early enough, and so often we are seeing patients presenting to us at much later stages in disease. Women are underrepresented in vascular research. Across the board, less than 30% of large studies have women involved, even though they make up 50% or more of patients who have peripheral arterial disease. Studies have a more difficult time recruiting patients, and part of this may be education. It is important to educate our patients about the risks of vascular disease and about the long-term outcomes of vascular disease. We have studies specifically looking at the female population because we know that they are different. Their signs and symptoms are unique, and their outcomes after surgery are not necessarily going to be the same. We should be tailoring our medical health care to our patients. Most of the time, by the time patients see me, there's already an understanding that there is vascular disease, and I'm seeing patients at late stage in diagnosis, specifically in women. Our primary care doctors are the front line in recognizing vascular disease across the board, and specifically in women. Risk factors that affect our vascular system: high cholesterol, high blood pressure, a history of smoking, and very importantly, in women, a family history should all be discussed with your primary care doctor. As a female, as a granddaughter of a woman who has had vascular health emergencies, as a mother, I am specifically interested in women's healthcare and advocacy. There is an unmet need. We are not screening patients early enough. We are not representing them in research. And my goal, as unfortunately a small number of female vascular surgeons, is to make sure that I am a voice for my patients.